are tonight on Wednesday, a very warm Wednesday in Vermont, and we're talking about mental health in the time of COVID-19. And I'm joined today. I'm co-hosting this with Michelle Oslund. Is that how I say it? Yes. Okay. And it's amazing because Michelle's partner has been my son's teacher. I'm so that. And uh, also, I am joined by three other incredible women who've been working in mental health field across the state of Vermont, and also Tanya Vahovsky, candidate for. So I want to just open by saying that this issue is a great importance. It has impacted my family. Mental health issues impacted my family deeply, and I myself am a person who has anxiety. And so now I don't talk about it publicly often, but that's part of what so I'm doing it now. So I'd love to open the floor now to Michelle to just talk about why she also thought that this. And I just want to say that Michelle is a new state for Winter State House. You have to unmute.
Boslin. I've about 2 weeks now, and Brenda and I were talking about the idea together, and I said mental health. That was the first issue to talk about. I work at the assistant Brattleboro with our recent long, and I not know there's very high correlation about 50 majority of the people that I work with. And like Brenda, I have impacted by large area advocacy as well as in my professional life. I've been a volunteer in Vermont. I'm on the board of HCS, and I just have had my life both impacted by that advocate sensible policy.
Thank you. And so now I'm going to introduce each person, and they can actually do their introduction themselves. And I will start with Laurie Emerson.
Hi, thank you, Brenda, so much for inviting me to be here today. My name is Laurie Emerson. I'm the Executive Director of the National Alliance of Vermont. And NAMI Vermont is a statewide nonprofit grassroots volunteer organization. And we provide educational classes, support groups, and we also advocate for mental health in the legislature. Well, I serve on many different statewide mental health committees, including the Suicide Prevention Coalition, and I serve on the commissioner. I'm a commissioner on the Mental Health Crisis Commission, and I also serve in a leadership team, not cooperative practice. I first found NAMI Vermont about 17 years ago when I attended a family support group. Then I went on to attend our 12-week family class. Very helpful for me to be able to get the skills, the education, and the resources as a family who's been impacted by mental. So I really appreciate being here today, and just talking about mental health is so important because we all have mental.
Thank you so much for joining us, Laurie. And I think this is an issue that has not been talked about enough, and it has not been, we have not improved it enough or funded it enough state. And so it's something that we really do to bring out in the open a lot more. Now I'm going to introduce Christine Bullard.
Hi, everyone. My name is Christine Bullard, and I'm the HCRS liaison. For those of you who don't know, HCRS is Healthcare and Rehabilitation Services. It's the local community mental health organization that covers both Windham and Windsor County. In my role as liaison. I'm embedded within the Vermont State Police at the Westminster Barracks, which conveniently also happens to cover Windham and Windsor County. My role there is to support individuals and families who may be experiencing a mental health challenge, provide support and resources, and really help them navigate the mental health system, which we all know some days is challenging. Um, so thank you for inviting me to be a part of this. I appreciate it.
Thank you so much, for Christine, for being here and for all that you do as well. I'd love now introduce my good friend and fellow candidate Tanya Vyhovsky, who is also who I try out her last name in different ways all the time, and the candidate for State House Chittenden.
Tries out my last name time. I have lots of funny stuff like that, but I'm Tanya Viho. I have a private practice work as I am half-time and I myself was given a mental health label at a relatively young age and sort of told that I should just write off the rest of my life, which I didn't really buy. And I've been a long-term activist in the mental health world. I have fought for human treatment, humane and human treatment, and I've worked with state government to develop the Vermont Support Line to provide supports to experiencing any range of human struggle. Um, and so that's really been where I've devoted a lot of my time and energy, both because of my own experience and so many that I found me. I think it's so important that we dig deep and look at all of the many factors that contribute to mental health don't exist in a vacuum, and our mental health is part of our whole.
Yeah, and I I think that that's entirely true. And really, when we talk about any issue, they're all intersectional. And I want to just, I'm Brenda Siegel, and I started to introduce myself before. I've been a long time advocate on many issues. Substance use disorder is I've done primarily in the last 2 years, but as well as economic justice. And I want to say, as someone who's experienced trauma and watched family members who have experienced trauma, uh, in the need for us to address mental health challenges, trauma, and the capacity to which we are not fully serving the across our state and country is a huge factor. So when we're talking about COVID-19, we're talking about a time when people are isolated at home. For some of us, for me, for the first 60 days, my anxiety was actually much better, and but if it's triggered in that time frame, then it's tense because you're by yourself and you do not have all this. And so that happened for many folks because of and other that have gone on throughout the last and will continue to go on for quite some time, because even as we go back to some version of public, there's going to be another wave. And so making get that we get more stable supports uh, in the meantime, so that we're better ready and better prepared, and having this discussion more open in my mind. I would love now for each of our panelists, if you have I just want to let folks know that if you have questions, you can post them in the Q&A. If you're wanting to just have a discussion, go ahead and put it in the chat. It's hard for us to follow the chat in terms of finding questions, but we'll try to get to as many as possible. Sometimes we don't get to them. And then again, if you have questions and they're in the Facebook live stream, then Jacob will be monitoring that. If you're watching anywhere else on any of the other places that's being streamed, we may not see a question that comes in. And we still invite you. We'll put the link into the live stream. We invite on my page, which is Brenda Siegel, and we invite you to come in and attend and be part of the conversation right here with us. So I will go ahead and start with Michelle on what you've seen in the last 2 months and where you think we need.
Michelle, you're muted.
I think about people looking for and self support my work with incarcerated and in my volunteer um, family support groups members who are affected. Both of those areas have modified into our during the time of COVID, everything either to support or online. Times it's but in just about not an option. And there are times where, well, I have family at a, in, and able to get support, stress, and sense of all virtual. Great. And out of the hospital, family was. But I also have had people that I work with don't want to do in person with about 4 or 5 other people. And there's some people that live in crowded groups every house. Some people that live with other family members. And they don't want to have a group. All their members are not private. And if they're really trying to care about that kind of environment, is not conducive. I have had people have not had understand the need to protect public. I do think the cost of mental. I would say that another area that is always a challenge before COVID, lack of psychiatric providers, psychiatrists, psychiatric nurses, provide medical support when they're in a crisis. And I was working with months ago, actually before and he got out of prison, had an episodic also asked me for a psychiatrist. And I called, found out was that once he could have an appointment with a psychiatrist, not accepted. The alternative is to go inpatient, and that in that kind of not going to get service that you actually develop a rapport. And that's an area that with my chronic, at least in southern Vermont, there are not enough providers to psychiatrists. That works to the detriment of struggling. Another area that's much a chronic problem is that issue both with the number of beds in tier 1 beds in mental health around the state. That is actually getting some over time, but there also is residential caring crisis are not quite at that level. You might have somebody having a mental residential that doesn't actually need, and there are so few that offers supports. They're not as less expensive for beds. I have a family that for I had to call 6 or 7 times, never been, and that's another thing that's a chronic need, not just a. But there just aren't some at higher level. Those are both. And third area that I hope someone else will talk about is concerns about stress on individuals isolate. Have been some reports that suicide rates actually I don't think that's true. I've read some and I about that access to guns in our state that has been 5% of deaths in our all these people locked in their house and depressed. And those are the things on the top of my mind.
Thank you, Michelle. That was excellent. And I will welcome Lori Emerson. Same.
Sure. Thank you so much. I think I can follow up on what you were talking about, Michelle, with the suicide prevention. And, in 2018, there were about 118 deaths by suicide. 2019, there was 105 deaths here in Vermont, which is more than the amount of deaths by car accident and homicide all put together. So being able to have those courses, like talking about, have people be able to get the help exactly when they access to immediate care is so very important for. Without that, um, escalate for. And there's been a lot of anxiety about people wanting to go to get, even though that they need to get help. Luckily, there is telehealth, and that is work for a lot of people. But then there are those people who like that connection, action with, and they're not getting it. Have created routine and are living in recovery. But now with COVID-19, everything is just up in the air. So their routines have been. They're not able to do all the things that their own self-care strategies. So that's been very difficult. And side, people, when you're isolated, when you have nobody to turn to, don't have a phone, trapped. And unfortunately, there have been that have happened with people who were not having that person out to. Sometimes that's all it takes is reach out, have somebody listen to you, be able to talk without having. And I know, Tanya, there's not support line, which is great. And I understand they're now 27, helping people tremendously. So other needs that are out is how their stress and anxiety will help also affect their depression. They feel very overwhelmed. Being able to have those connections that are available to them are so very important. And a lot of people have their own support system out to. So that's why it is so important that we're all connected by phone or by Zoom, Skype, whatever software. And really encouraging everybody to reach out to anybody especially someone living alone by themselves. They just want to have someone to talk to, not feel so isolated. And I think this is a great opportunity because we can start talking about mental health, start talking about suicide prevention and the stigma so that people are getting the help.
Sorry, I do have a child at home standing in front of me right now, so I apologize for taking a minute there. But that is the time of COVID as well, and I think that's been part of it. Actually, I just want to say that that the expectation on parents and on family members, and also when you see everybody baking bread and maybe you are not baking bread every day, and those kind of things. If you the ability to feel more like a failure if you already are struggling with that, or the ability to more inadequate if that's already something you're struggling with in a world where you yeah, is struggle. On the other hand, we're seeing a lot more real uh, things thing too. People are being a lot more real about well. So, um, and I also want to at some point get to substance use and how that is being impacted by because I've engaged in that and I've heard. I'd love to welcome Chris.
Where to begin, right? All talked about stress, anxiety, depression, financial strain, changing our routine. We have folks who are parenting at home and homes now homeschooling and trying to uh, work their regular job. Can you hear me? Okay. All right. Um, Not to mention teens who want to be with other teens, right? So all these things are impacting folks through COVID-19, social isolation. Um, I did want to speak to your question about suicide. I talked with Kate Lamphere today, and she's the head of adult services for HCRS. And she was talking, I asked her specifically about the suicide rates. And at this point, we have not seen a rise in suicide rates, but it's something we are very concerned about and monitoring and watching because you look at so many of those risk factors, right? Social isolation, stress, uh, being disconnected, uncertain of so many things. So that is something that we are definitely concerned about. Um, the other piece I think Michelle touched upon is everybody is doing their work a little bit different, right? She talked about HRS is using telehealth or telemedicine. And for some people, that works really well. For other folks, uh, as we even experienced our own technology that, you know, issues, sometimes that's problematic for some folks. Either they don't have access to it or struggle to utilize it. So we talked about doing things a little differently. Stress is up and fully functioning, but is using telehealth and medicine. And like I said, sometimes it's working well, sometimes it's not working well. As you know, I work with the police specifically, and so even the way they respond is a little bit different. Maybe a welfare check would be an in person. Sometimes maybe now it's a phone call, and that's a little different. Or if somebody's in crisis, maybe the response was, we'll go right to the emergency room. And now that's more a thoughtful conversation. Is that the right thing to do? Does that work for that person or them more in jeopardy being in the ER? A lot of times we turn to natural supports. If there's some other place someone could go, another connection. And during this time of COVID-19, some of those options are limited as well. I know another thing that I did touch upon, for some folks who are going in an inpatient facility, they're requiring COVID-19 tests prior to uh, going inpatient. And so that can be a barrier, a day or two waiting for those results. Those are some of the things we've seen. And I wanted to bring up one other thing because it really resonated with me today. Um, Twice now I've participated in the National Guard and the food bank, uh, distributing food and being there just to check in with folks and just asking like, are you okay? And some people have written back and saying, wow, that was just so powerful to have somebody say, am I okay? I've gone up to some cars where people just burst into tears and, say like, never did I think we would be in this place or where we're at. So it's just such a different time. And I think for everyone, it's been a challenge to kind of sort through, but I think it's been even more of a challenge for folks who really are kind of on the fringe, right?
I have a bunch of questions. not going to ask right now because I want to give Tanya a chance. But before we go to Tanya, I just wanted to say that I had the opportunity to wait in that line today, because I struggle financially in the first place. And I had a lot of thought. It was actually where I decided that I would talk about my anxiety. I wasn't having it, but I was really sad to see that many people hurting. But I also had this reflection on all the people hurting for so, and never is there a food line like that,
Yeah.
and never is there someone delivering food groundwork for us. You know, we are skipping meals, and people aren't. I mean, there are groups of people wondering how folks are going to eat, but there aren't. But it's not. We're not as a community always wondering effort about how are we going to make. And so I had a lot of reflection, thinking about all the people that must be in that line who have never experienced being, and
Yeah.
what that might be. They already have, if nature has already, you know, created anxiety or depression in them, and now basically not a good enough. That's, you know, it's. I think that that food line is really powerful image when
Yeah.
you see it in photographs and when you're in it and when you're helping with it. Also, I don't really know, so we'll find out. All right, Tanya.
So I think one of the things for me is that COVID, this crisis with COVID has really there. I'm Christine, can you mute yourself? I'm echoing off of your sound. Sorry. So one of the things that COVID has really laid bare is actually the many things that have always been an impact on our mental health. If we're truly going to affect mental health change, we have to dig beneath the medical model and individualism, and we have to dig beneath pathologizing and reactive, and in many instances, I think pharmaceutical interventions to real human interventions, meeting people where they're at and providing access, community, and preventive supports that are flexible and that are human. I remember talking to someone who came to my office with a list of diagnoses and a list of hospitalizations and a list of experiences. And I asked her what she was looking for, and she said, help that's actually helpful. And so when I hear people talk about people being worried about going into to seek help, it's so frequently the help they receive isn't helpful. It's harmful, it's traumatizing, it takes away their sense of autonomy and humanity. What I've seen in COVID is that if given under the right circumstances, any one of us criteria for a mental health condition, it's a human experience worry and sadness, deep depression based on what's happening. And what I've really seen with this COVID crisis, particularly my own caseload, is a lot of the people who struggle the most in the day to day when things are normal are doing fine. And the people who have usually got it together are falling apart. Because what's happened is this system has turned on its head and we're seeking a different set of coping. People access the coping they need in the world, and in many instances, apologized in the way we normalize. And right now, our normal is upside down. And many of those people are like, nah, I struggle with this every day. I've got this. And the people who usually assume they've got it all together don't know what to do. And so I think that what this has really showed us is that these struggles are a universal experience. And when we dig beneath some of the models that pathologize humanity, we are faced with the impacts of poverty, impacts of domestic violence, impacts of structural inequity, impacts of trauma. In reality, the single most related experience to a mental health condition, it's upwards of 90% of people who have been diagnosed with some sort of mental health condition have a trauma. And that's a by self report. So I suspect that many others have had that experience as well and don't equate it as trauma, because I know there's a lot of feelings around that language. And so, and there's so much more mass incarceration, the lack of health care. I can't treat mental health care if they cannot afford it, or their health insurance doesn't cover it, or they lost their job due to COVID and no longer have health insurance. And so the reality is that what we're seeing right now is uprising, something that could happen to any one of us at any given time. And I think we separate ourselves from that by saying that's something that happens to you and not something that can happen to me. Safer showed us is this can happen to anyone. And so I think if we're going to build something that really it has to be based on sectional justice. It really acknowledges many facets of mental health and that it isn't just mentally unhealthy. It's that we live in a society that is active and deeply unhealthy for the majority. And those are the places where I feel like we have to shift and change. I so frequently sit in my office and I feel like I'm like, great, I gave you all these really great coping mechanisms, but I'm going to send you right back into your unstable housing with your abusive partner where you can't find a job and then you're going to somehow feel like you failed. And me, I mean, that's why I'm running for office because I felt that so many times in my office where I felt like I was plugging holes. I was giving people tools to go out into a world that was never going to truly welcome them and accept them. It felt like it was not to go and fight the systemic issue to these things. So I when I think about that, it's investing in our society and our communities and investing in preventive supports. There's a place in Rochester, Vermont. It's called the Lissam, a two-bed facility where people can go and just experience the range of being human and be provided support in a way that is flexible. And that's really what I was trying to do when I worked support line is provide people a space that wasn't limited to 50 minutes, that wasn't limited to do you check the right boxes on this diagnosis form, but really just said you're a person and I'm a person. And we've all experienced struggle at some point in our life. So let's just be together. In my experience, the only times my struggle helped me, I was shame and alone. And so that's to me the investment is down shame and it's in building community. It's letting people know that I'm your neighbor and I'm here for you. And so there's so much here to do. And it is, as Brenda said, it's also sectional. We can't do one piece without seeing all of the different aspects that impact it. And it has to be flexible and responsive. And in terms of suicide aspect, one of the things I've done a fair amount of suicide prevention work myself. And one of the things I found most impactful in alternatives to the suicide model, which is based out of the Western Massachusetts. I worked hard actually to bring that model on, and there's running in now. I would love to say they're all over the state, but I was transitioning out of that role as that was happening. But the model is based in and I remember when I went to the first webinar and they said this isn't a suicide prevention webinar. This webinar is about building relationships, and the suicide prevention comes from that. It comes from really sitting with someone and saying, I see your struggle. I'm gonna, and so I think that for me, it's about building together and making sure that people have what they need out contingency, out requirement, saying, what do you need and how do we get it?
Everybody had so much to say. And it was no, in a good way. It was like there was so much information. And I think that's because uh, the, well, like I said before, mental health is not talked about enough, nor do many of us who feel it fess up to it very often. And that's because of the shame that comes with it. And we have the opportunity to change that. And we have the opportunity to change that, right? It's just like with all the issues, I keep saying this, but we've left ourselves an empty shell of what we once were. We have this opportunity to be better. And I think we have that same opportunity there as well when we're talking about uh, how to come out of this. Because there are a lot more people thinking of what it feels like stressed or without money or many other issues that come along with it. And one thing that I learned my for those of you that don't know, my in 2018, it was March 7th when I had decided that I would run for governor. On March 8th, my nephew died of a heroin overdose, and he was the son of my brother who died just my world turned down. But in the 7 years where I was supportive of him and helping him and my whole family there's so much I learned about our mental care system. And I had myself suffered, like I said, from anxiety, but not in, I was able to, and I was able to hide it, or I was able to keep moving constantly. And if I move constantly, I have to experience it the same way. And those who know me know that's part of what drives me. Uh, but for him, he had bipolar, and just what you were saying, Michelle, in the beginning, he couldn't find psychiatrists to prescribe him medication for his bipolar. And without the bipolar medication, had no chance of staying in recovery. He needed the Lamictal to stay in recovery. And then you have the added pressure like medication, but for some people that is the way. And so I if we could remove judgment from deciding how people take care of themselves, or deciding when they're in recovery for them, or deciding what people without having them at the table to be part of that discussion. Uh, as Tanya was saying, I think that would go a long way. And we have this moment, like I said, right now where we could build in that because more people right now understand. And I do worry that if you get past this and people is easy to forget, much like we do forget delivery when we have a baby. What allows us to have the next baby is that we don't remember exactly what that was like. And so it's a similar, any kind of trauma is similar. If you get away from it far enough and you're not having repeat traumas, then you may forget what it was like to be there. And so I think we have to talk about it right now. Michelle, I mean, not Michelle, Christine, I had a question for you. You were talking about a lot of the changes that the different ways HCRS is operating, and some of them sounded like they actually would be good they would be for a number of people would really like that, not immediately, that we're having, like, is that really what you need right now? That these are discussions that maybe should have been happening all along. So I was wondering if you could talk a little bit about that. You're muted though. So you're muted.
There we go. Yeah, I think more and more conversations like that. Clearly, in my role, that's part of my job is to help explore what options are out there and um, what works for them. Because it's not one way, right? Different things work for different people, and um, so I think the crisis team and the embedded mental health workers have been doing a lot of that exploring. Um, but but now you got to get even more creative, right? I think that's what we're doing, really kind of stepping it up a notch and trying to get more creative uh, and have a positive outcome instead of just adding more and more stress and anxiety at this given point. Yeah.
Does anybody else have any thought? I mean, I had telehealth, just a regular doctor's appointment, and just once during. I seriously, I believe I posted about it, and I said, can we just do this all the time? That I didn't have to drive back and forth to Dartmouth. I didn't have to. Why was this not offered to me as an option in the past? We did have the internet. My life would have been so much easier to not be trying to figure out when I can get there for an appointment. So I
Brenda, I was going to say, one of the kind of fun facts for us is we have seen a drastic reduction in missed appointments. People are liking being able to either hop on their device and make their appointment. You know, uh, Clearly, barriers like transportation have been eliminated. So there are a few positives here, and hopefully take these things that are working as we move forward and incorporate them in our regular practice, right? Yeah.
right, yeah,
HRS has done some other things as well. They've always had the crisis line, right? That people, but also added a warm line for things that other folks were talking about, that sense of connection, having a place, having a number they can call, talk, share what they, it's not about advice or pearls. It's really just about making that connection and being there and knowing somebody has a place to call if they want to just reach out. So I think that's been a huge addition as well. Um, HRS has put in along with the crisis line.
Does anyone else want to talk on the positive aspects of what has come out of this?
So in my work, I've actually um, when I first started doing support circles, skeptical, like how am I going to offer support or on a telephone, have a screen? In some cases, I've said, and I was really concerned that there wasn't going to be depth possible when we weren't sitting body language. How can this possibly have the same depth that we have when we're together? And sometimes that has been true, but overall, I have been at the ability to connect in a have like with the right now. I mean, I'm looking in all of your living. Oh, I'm talking to my bedroom right now, and that's when I'm working with my clients. My volunteer, I see some butter or pet or walking on the pool, and there's a different level of shows up when you're talking to. That was an unexpected positive, and even like ones that are the I have some people that I don't see in the background. You'll see elderly mother talking to the so and so go to the grocery store, and it's something that's about connecting with other moms. And I can't say that I would want, but under the circumstances I have right now, there has been this other side where I feel like both the volunteers fighting the staff members, we're all getting to in a possible. I'm actually really that, and it was unexpected.
What I've seen that's been very positive is more of a focus on more of a focus on helping housing, the basic needs, food, um, and now looking at if we help the homeless now and doing these things, find them a permanent home, to be able to stay in. I'm hoping that this will continue with being fundamental health and be able to fund these social programs that are so desperately needed. And I feel that had more of a focus on mental health, and everyone has been affected with their mental health, and really looking at those first responders and how their health has been affected in terms with how do we all support each other. And a lot of times it's really helping that circle of support, because finding those commonalities can really help. And I've also seen that there's been very deep be able to help them. Talk with them almost every day. I think maybe people are even calling their loved ones who don't live with them every single day. So there's been that real care.
The things or a few of the things that I've seen that I feel positive about is that we have in some way been just nature of the pandemic been less reactive and about how we meet when when they might be struggling some of the go-to options aren't available. I also think communities come together in a way that I haven't seen in a long time and really expressed care about the unknown. I've seen networks come together to make sure that their communities are getting what they need. And that gives me hope that we can do it. I've also seen us make, as you were saying, Lori, really rapid changes to meet human needs. So frequently I hear we can't do that. Where's the money for that? That'll take too much time. And the reality of it is this came up and very quick shifted everything we were doing, and we got people up the street, got people out of jail, we got people, like, we got people supports, we got them connected to volunteers. So the reality of it is I think the biggest hope that comes is that we in fact can come together and make sure that people have what they need, and we can do it quickly. And there's no, for me, it takes away one of the I always get when I try to push for real radical change. We can't possibly, but actually we can. And we just saw a whole country, a whole state mobilize to make really radical changes really fast.
Yes, it's almost if we all and I think that there's the positive change that I've seen a lot of positive changes just personally. But one thing I've really appreciated as a mom is, especially a single mom, I've experienced a lot of feeling like I have to pretend like I don't have a child so that I can function in the world, and so that because they don't coexist together. The reality of parenting and being, a candidate, a director of a festival, any of the things that I do in my life, but really any working person, or even staying at home. And one thing I've really appreciated is, I remember 2 years ago we saw that video of that guy who was on an interview, and then his kids popped in, and the nanny came and took the kids, and now it's like a regular occurrence to see people's kids pop in or be part of it or hear children's TV. I was on a lieutenant governor's forum last night, and the host, the person moderating, that there was children's TV show happening in the background. And I think that, oh, and Michelle just corrected me that that was the guy's wife in the video. So I apologize. For some reason, I heard that it was an, and maybe that was why the confusion. But so I think that that can help take away some of that pressure that I think parents to pretend that they're not parenting while they're trying to be. And one of the saddest things for me, a number of things parents can't do because we can't have our kids fit. And it turns out we can have our kids. Sometimes it's really hard, but a lot of the career path I chose done around because I'm a parent. And so uh, I think when we start changing that, I think that opens up a lot of things that we do that will help with people's mental health. Because not pretending that your children aren't the most important thing to you when you're doing anything else is third thing to expect of people at all. So so that is one of the positives I've seen. I've also seen, really, I've made more time to talk on the phone with friends or catch up with friends. I'm usually running about the state all the time, and so I have actually had moments to spend, laugh and be joyful with friends for no reason, laugh and be joyful. I think that that has been great. And then lastly, and I've heard other people say this too, all of a sudden I do notice all the I wake up because I'm not going anywhere. So even if I have the busiest day, I still hear all the birds and see changing. And those things are things that we don't take time for. So maybe, or I hope we are learning to find a way to get back to a place. I am going to try to handle one question. I'm not sure. Cheryl asked, I'm not sure if these are all questions. So I'm going to start with number one. So, on delivery of trauma informed care, I don't know if this is okay, yes. On delivery of trauma informed care from hearing patient experiences, we've we've heard stories of patients being triggered or caused harm by those who are supposed to be helping us, that indicate our medical and mental health professionals lack training and trauma informed approach. How would you propose to root out the causes, one on the system structural level through policies, practices, and two on the individual level, e.g., the same perps repeatedly reported separate patient review, example on Yelp, that are causing patient harm? And how would you propose to address of these areas in so for this portion, if you want to just raise your hand and go, I can't. So who would like to go?
Can talk to it a little bit. I think we have policies in place that are meant to protect people, and I think don't do a good enough job of making sure people know what those policies are and how to navigate the systems to make sure that people with more power don't get away with abuse less power. Because the reality of it is that the relationship between and I'll speak to myself as a clinical social worker, the relationship that exists between me and my role as someone in my office is one where I have more power than. And I think we have to transparently own that and accept that, and really make sure that that anyone coming in knows exactly how to navigate the process and that their voices are lifted up. I think that too frequently we privilege certain over others, and if you are someone who seeks mental health care, your voice is automatically less privileged because I've had that experience myself as someone who has been given certain labels as someone who is a woman in the world, where when I try to seek justice against someone who has more power than me, I'm immediately discredited. And so I think we have to address that, and we have to talk about it, and we have to believe people. In two separate instances in the last 2 weeks, and it's not mental health related. One of I mean, maybe it is. I don't know. But in two separate instances, I had issues where people reached out to me from positions of less power asking for help. And the immediate response was to question whether they were. And in one of those instances, it was a group of individuals at North Beach being removed from their campers and sent away. And someone within that community said, "This is how this is going to go down. Many of us won't be able to get hotel rooms. And this is what's going to happen." And I fought and fought and fought to get people in positions of power to listen to them. And ultimately, they didn't. And exactly what they said was going to happen happened. Many of those individuals were not able to get hotel rooms. And I was furious, and there was nothing that I could do in spite of that advocacy. And what I saw was a systemic breakdown. Those were people that we don't listen to. And fast forward a week later, when someone is reaching out saying, I live in subsidized housing and they're going to spray with pesticides. And the immediate response I got is, that's not really happening. This time we fought and we were able to get it stopped and get the proof that, in fact, that is what was happening, in spite of the landlord insisting they weren't doing it. And so I think we have to shift and believe people when they say something not okay is happening, and not immediately assume or discredit because of some late.
Okay. So I think I just said to the panelists, if you, I don't know if you had a chance to look at questions that are in the Q&A. If there's one that you think you're prepared to answer right now, let me know, or I can go on to the next one. Have a chance.
I could question about peer live. Cheryl asked, "Support is often the most effective message that we're not alone. Other flock together. Society creates on the." And I guess what I would just like uh, Tanya mentioned, bed rest in central Vermont that's available rested, having a struggle downtime. challenges, great, but not a lot. There are some slightly more specialized models. Also, one other residential people are young adults. It's a run facility that support and strategy, and it's medical consult. That's not the primary model there. It's been very effective helping developing pediatric illness cope with strategies effective. But are there and honestly have somebody in crisis and they feel like they need support, choices the hospital or maybe lucky you, and it feels to me wise for the aunt to invest in more residential support places struggling. I have family members who not for everybody. Hospital. So in terms of Carl's question, I believe that having more peer model, very positive model. Also, there are peer support groups around the state, and I believe are some of those happening on. I'm not sure happening online, NAMI, but there have models to pass that because they have been very effective for a lot of people.
Absolutely, there are family support connections, and are online or they are by phone. They are on the NAMI Vermont calendar or other groups are really it's the core competency of our lived that really helps make clinical intervention. So it really helps to complement both, be able to have that as well.
One thing that comes to mind for me and thinking about peer support, one thing I've seen having developed the support line and work in that world is that we can't underpay those. I think all too frequently what I've seen happen is the supports being provided by people given the of peer support are undervalued. I mean, I think all helping professions are undervalued. And speaking to one of the questions I saw from Cheryl about the medical and mental health provider shortage is that's not something in our society that we value and that draws people to it unless they want to sacrifice ever being really truly comfortable. I know myself, my mom tried to convince me to be a lawyer because then it would be easy for me to make ends meet, and having grown up in a working class home, that was really important to her, but it was important to me to give back. And I don't think that's a choice that we should have to make, to be able to be comfortable financially or be able to give back to our. And so I think it's really important that we think about what we value and how we show that value. And I think that the peer support is invaluable, and in many instances is the only way people are going to access supports and can save people's lives. And I therefore think we have to financially value it the same way that we other support. I think that everyone has a different pathway, and if we're going to put our stories on the line and our hearts and our souls on the line, and we're going to work to make sure that people are okay, we need to be compensated for that. One of the things I struggled with a lot when I was developing the support line was feeling the state really wanted to underpay the work that they were asking people to do. We're going to pay minimum wage for that. I was like, you're not going to pay minimum wage for someone to sit on this line and pour their hearts and souls into work. And I had to fight to get above minimum wage, which to me is just ridiculous, the type of work that people are doing. And so I think funnel that money into those community preventative supports in a way that is fair and really values the work and the time that people.
Thank you. And I really want to quickly say, if anybody else has questions, if you're watching on a live stream and you want to come in and ask us questions, you can. And also, if you're on the Facebook Live and you want to ask questions there, you can. And if it's on my page, we'll be monitoring it. But or you can come in and ask. And I know that that's very confusing. How many questions? But we have one Facebook question that I do want to address. I know that I'm sure some of you are looking at Cheryl's other questions, but I just want to address this one from Michael Stern. How many mental health professionals do you think we need moving forward? Social workers and psychologists. Is there any expected funding? Are we all contending for the same federal and state budgets? Good question.
One of the things I can say, um, the Vermont State Police, their mission is to embed a mental health worker in every barracks. Currently, there is one up in St. Albans and myself in Westminster. But I do know their goal is this year to embed someone in every barracks. You know, the lieutenant said it'd be nice if we could run somebody every shift. So and I know HCRS has worked really hard to get a mental health worker in all the local police departments in their catchment area as well.
Yeah, I will say that I have regularly met with the Addison County State. I've met with state's attorneys all across the state, and one of the most universal things that they say is one of the problems that they have is that they don't have that options to make different because they can't understand not how they're and so they have been begging for embedded social health workers in those settings and something that would help with folks with substance use disorder, something that would help with folks with disabilities, something that would help with folks with mental health issues. I think we it's something we need. I don't know why we haven't fully funded that yet, but I've often thought that if I've said this a few times to a few states attorneys, that if we all come together, even if places no we disagree on a lot of places and we agree on others, if we all came together and said these are the things that we all agree did, then I think we would have a lot of power in making that happen. And I know that he feels, Addison County State's Attorney feels that, or his numbers show that that crime rate has gone down in his area since he stopped putting people in jail so much. And so that's a very real. That's it's one area, but one area is where those changes start. And I think that his name is Dennis Wigman, by the way. I just calling him the Addison County State's Attorney, but he has some really incredible um, on mental health and just the way that process. And we have this I just keep saying we have this opportunity. Like my mantra for this entire campaign, we have an opportunity to actually change something. But who knew that we were going to have COVID right now during the time, and how interesting it is actually. It is during this time when so many people have a platform to make a change. And so I really appreciate all that work. Do other folks have any answers to Michael's question?
I just want to add one piece of budget priority. In the last year, I actually ended up sending written testimony on behalf of actually both NAMI and HCRS asking for increased funding. I think about three asking for to, and I think in the end what happened was level funded, which means they got the same funding they got last year. But because there's inflation, that really got a cut. And so I hear a lot of people involved in the process talking about how they value mental health and health programs. When it comes down to it, money somewhere else. Level funding year after year is not level funding. It's a but because the economy doesn't stop, it happens. And I think mental health is so intertwined with other things. It just doesn't make sense to not be funding mental health as a prevention and also.
Want to echo off of that because in terms of funding, the reality of it is, and I think we see this across the board, is that the money is there. We can give trillions of dollars in tax cuts to the top 1% and corporations, and we can funnel billions upon billions of dollars into a military that is 10 times larger, that is larger than the next 10 countries combined. The money is there. It's the political will, and it is about priorities. As you said, we are the richest nation in the history of the world. We can make sure that our people have what they need, the health care that they need, the mental health care that they need, the housing that they need. And so yes, in this moment we are fighting for that same pool of money, but I think if we can shift the conversation into a conversation around human rights and a conversation that really focuses on the fact that the money is there, we can make huge changes and we can make them quickly. We just did. And we can stop having a conversation based in austerity and based in fighting for scraps because it is there. We can do it. It's about whether or not we want to come together to do it. And so, from that standpoint, there's no argument that we can't. It's that we won't. And so, I 100% agree with you. If we're going to say we value mental health, then let's value mental health. Let's put the money into it, particularly preventively, because it's much less expensive to prevent someone from getting to the point where they need massive amounts of services and the police are involved, much less traumatizing. So why aren't we investing in moralism, more community supports, and more hours and operators on the Vermont support line? Because I know that they've gone to 24/7, but you still have to call and wait hours for a call back because it's not staffed enough. Why is that not what we are investing? I did a study after my first year on the Vermont support line. We did an anonymous, and it was optional. No one had to take it. One of the questions we asked is if the person would have called crisis or gone to the emergency room if they hadn't called us. And then from that, we tallied what that would have cost if they had access to those. Presented the state with the $1.2 million that we saved them that year, and simply asked for that back. And of course, they were like, "Nope, can't do that." And so the reality of it is that investing in our community, investing in taking care of our people, not only is it the main thing to do, it saves us money.
That's exactly what I was just about to say. I was about to pick up on that and say the strategic investment that we need to make in mental health care is not us spending more money. It's ultimately long term, and that's true with so many of the issues. And I think also if you haven't been in a family where you've been impacted, then you don't really. It's hard to understand what it feels like on that end. It's what it feels like for the family member, what it feels like for the individual, and what kind of stress and pressure that you're putting on those family members, and how that might impact actually our. I'm just going to go into the money argument. How that might impact our overall revenue, for example, as a state, if people cannot be functioning and family members. And so I think, but not even just that, the long term impact of for children who are living in a household where their parent might have experienced PTSD, mental health issues, kinds. And so I think it's so important that uh, we understand that we're creating generational. And we certainly saw that in my family, generational trauma, generational ended with death for family members. I worry that right now what's happened is higher generation just missed a big portion and have experienced some kind of trauma. You know, ways relative, but experienced some kind of trauma and we're already talking about cutting funding for, and I don't, and that is going to play into these kids are going to come back and have mental health issues, trauma that from the experience of being here, and also the awareness that we may end up here again. That's when you're afraid, there's going to be a second wave, or you're likely there's going to be a second wave, and our kids are hearing the news, hearing us talk about it. They understand, and also it's impossible to hide your mental health issues or your fears or sadness if you're with your families 24/7. And so they're also seeing things, which in some ways I think is healthy, but some of those things are not. And so I would love for just, sorry, I don't know if you have any to add to that, but I think that's a place where we don't often think about that intergenerational trauma aspect.
Right. And I think this COVID-19, and when we do get back to going back to school, having more people there with social emotional experts to be able to help students. We're going to need people in every single. I did go to a conference, educational. I was very surprised to learn that classes are disrupted on a daily basis with children, and there is such a great need to be able to have health counselors or social learning in those schools to be able to help. And really, in the community, meeting people where they're at, meet them in their having crisis really helps to escalate a situation so that it doesn't get to the point where a person would meet. So how do we meet where they're at, give them the services they
Yeah, I'm very concerned about when we're talking about have to come out of this crisis, like the uncertainty and what that and is. Uh, I did anyone else look at any of the other questions in the Q&A and have
And I just want to say that as a school social worker and one of the social embedded in the conversation, having a lot, and I was horrified to see the governor suggesting that we vote to lower budgets. The reality of it is that these kids, we are experiencing collective trauma to some level. All of us are experiencing heightened stress and more amygdala based responses and less prefrontal cortex responses. Like we are as a society are experiencing collective trauma, and that has an impact. And we are having conversations in my student. I mean, that's what I spent my morning doing, is talking about what is the like, how are we going to welcome these kids back and rebuild a sense of community and meet their social needs. I mean, we're not even talking curriculum. We're simply talking like, how do we get these kids back in this building and make them know they are safe? Because if these kids do not feel that they are safe, they can't learn. And then add to it that some of these kids are in homes where they are not safe. And so there are so many pieces coming together. Like, I had to sit down with the administration at my school today and say, I'm really nervous about what the fall is going to look like. We don't have everything we need, the very best of it. And next year is not going to be the very best of it. I mean, we are going to, as teachers and social workers and care providers, we're going to give it our all. But we need the government to step up and make sure that we have what we need to give it our all, so that kids are okay and the families are okay. It's really weighing on the minds of what is next year.
I had another question. Uh, I am wondering because we hear embedded social worker, embedded mental health worker in police barracks, but we don't actually know what that. So I was wondering if you could tell us a little bit about what that looks like, or what a typical day might look like for you, or if there is a typical day, and how that works. What kind of things you do to offer folks and make your help process. You're muted.
Better. Okay. So while I'm hired by the local mental health organization, the only place I work is at the state police barracks in Westminster. And so I sit in the troop room with the other troopers and have access to the same things they have access to when a call comes, whether it's a mental health call, substance use, uh, any individual or family who could use extra support or any kind of resources, and I get dispatched along with the trooper who or troopers, whoever respond. I think the goal is really we've talked about it so much. That human to human contact, right? Um, really meeting that person where they're at and having a conversation and trying to strategize what are the options, help kind of translate from kind of the lingo or the law to what can we do here, right? Um, Sometimes it's de-escalating a situation, and I know there are certain circumstances where we'll show up, and just because somebody's in uniform, that will just set somebody off, and their behavior will start to escalate, and I can um, try to step in and de-escalate. We work in tandem and try to have the best outcome for that individual or that family. I think the other piece of the embedded worker is we talked about being proactive, right? If someone has frequent contact with the police, so starting to build that relationship and keep contact and see about getting the resources that they need so they don't have contact with the police again, right? Just building that relationship. So I would say that's my primary function. I love the fact that every day is different. Every situation is different, and it really is just meeting people where they're at, helping to support them and connect them to the resources. Really ask what they want. How could I be helpful? What resources are they lacking or would be helpful to get them where they want to be? So building relationships. That's what it's all about. And I just wanted to put another plug in too. Talked about vetted mental health workers. There's also another group. It's called Team Two. I don't know if folks have heard of it, but it's really training for all police and mental health workers to work together, right? Understand what each other's roles are, how we work better for the people that we serve. And I think that's been really successful too, and very positive. Kristen Chandler is the person who heads that initiative in the state of Vermont, and I think really good things come out of that.
So I think that but we're hearing a bunch of really great resources, and in a few minutes, we have about 15 more minutes to answer questions before we'll have, I have a closed question to ask, but or should say about four issue-based events ago, I started always asking. Uh, but in the interim, if you do have any questions, please do ask them either in the chat or in the Q&A. If we haven't answered, if you guys can't hear me, let me know. I got your connection. And last night I was at a forum and I literally had to have 3 on so that I could during. Let me know. And I always look around to see if I can tell if I'm frozen or not. So I think that we're looking at these mental health issues, and we're looking at COVID-19. So when we talked a little bit about what has changed, my curiosity for all the panelists and folks who are attending too can absolutely ask these same questions. My question is, in what ways is this moving forward? What ways do we need to be prepared going into the next crisis that's waiting in the second wave, or even coming out? What should we be, either broad stroke or a few
I can answer that. When
and
Christine
anyone
was
can
speaking
answer.
just now, got me thinking. I've lived in Westminster for almost 8, and I've been involved in mental health support almost that long. And I remember before I had an embedded person, when there was a crisis, it was just the police, and sometimes that made it worse. Sometimes things escalated, and there were uncomfortable altercations, emergency help that were in crisis. And now that Christine don't hear about that happening in our county, but when you think about the state of Vermont, about it in I think it was last year, most of those. So, in terms of what can we having the Westminster, that actually happened of the different around the state. And if we have an higher level for emergency responders, both the people answering the call, also responders as well, people, that would be a positive. Get to the point, and yet if you're not aren't adequately have the right, and that's going to be anytime complicated time that we at how can we our people, and if they have a struggle, the people called on to help, helping them, not making it. And sometimes that happens, but we need to be more consistent around the state. Everybody know if they help, they're going to get help, and it's
You have a really great shout out to Christine right here. It says we need teens must reduce the stigma and the repercussions for. Yes, I agree. And COVID-19 has magnified all things. So, does anyone else want to take up that question? What do we need to?
I know one of the things that HCRS is doing is they're working on a client survey just to say, like, what's working, what's not working, and what can we take from that, incorporate it as we move forward. You know, the Zoom, the screening someone in their home through Zoom, like, that going to have to end when COVID-19 ends? Are there times when that could really be beneficial and work, right? So what pieces can we take moving forward that have been beneficial and really worked? I think that those are the things we're looking at.
Really need to be looking at having the option for the care that they want to have, by continuing telehealth and as well as in person, because some people it works better. So I think, really learning from this experience and taking these innovative practices that we continue, as well as just finding out from the community what helped you, what worked for you. Challenges. Most of all, and what's important is really invest preventive care, invest in community, so that things don't escalate, that we don't need that we're taking care of.
Thank you. Christine, I think you have to mute again because for some reason, you create feedback. You're static. uh, and is there anyone else that would like to answer that? What should we propose? This Tanya is the only one that has not.
I mean, I think we have to prepare for a truly make foundation. I think that much like when Hurricane Irene flooded our state, a lot of damage and heartache, and there was an opportunity to better system, get a state hospital that had been funded by the federal government. It was being run for many years, and we could have rebuilt that, but we had a choice to build, and I think we should have done more building in community supports and things like Alyssum, and the Vermont Support Line came out of mental health transformation grant funding that was a response to that. And so I think we have another opportunity to really build structural change, and that's what we're looking forward to is how do we take this crisis and build structural change that means that people get what they need in a way that meets them where they're at. I'm always worried when we say, hey, that works really well, and now that's what we're going to do. And so I love listening as Lori say that we have to build choice. Sure, telehealth is great for some people. It's not great for everyone. I work with kids and teenagers. Telehealth has not been fun for us. I mean, and so we make it work. We're flexible, we're creative, but I hate telehealth, and most of my clients do too. And I also have a therapy dog, and I do animal assisted work, and she's pretty miserable because she can't do her job. And the kids and the teams that I work with are missing her because telehealth doesn't provide that same hands-on experience. And yes, I love that telehealth is available, and I've used it in the past for maybe had unreliable transportation or for snow days because we live in Vermont and those happen. So I think that it's amazing that it's an option and we need to keep it, but we need to really, as you said, create it as an option and a choice and not just what we're going to do now because it's easier, and really add it to our toolbox and build so many additional tools so that when someone says, I need to meet on telehealth today, we can say, okay. And when someone says, today I really have to go for a walk in the woods and talk to you, we can say, okay. And when someone says, you know what I really need today, I need to build something and I need to get out my frustration, and we can say, okay. And it's not about did we check the right insurance boxes, but it's about saying, what do you mean I get it?
One of the things that we've learned during this crisis is that we can do most of those things. And so we do, it's important to reflect back on that as we move forward. I think I'm losing my voice. So it's important to reflect back on that as we move forward. And I really want to just, one of Cheryl's questions right here is that she wants to put a plug in for better brain injury survivor care. And brain injury patients are not getting the psych mental health referrals that they recognize that they may be suffering mental health issues, realizing that brain injury prevalent. She wants people to respond with action, advocacy, prevent re-traumatization, help them navigate the healthcare system. And I want to just speak to that for a second. Actually, one of the things that I haven't talked about as much, but my nephew, during his substance use at one point off a roof, I think is what happened. And he had a very severe brain injury. And he had plates replaced in his head and his jaw rebuilt and parts of his jaw rebuilt. And, he did not us, the family too. We didn't know how to react to that, and here he had substance use, had this one piece. He had a brain injury and did need pain. He obsessed in strange ways that we were not used to over things like he had to drink Ensure throughout he had his jaw wired shut, and he would really obsess wanting more of it. He and I joked about it for afterwards, but we didn't know, we were not prepared by doctors or anyone else potentially in uh, attaching to behaviors that we would recognize as child behavior. And we didn't know. So because we weren't prepared for that, it took us a while to say, oh, it's brain injury. And for him as well, he didn't have that same ability to prepare and know that that was coming, which was, I think, re-traumatizing because when your brain starts working, that's traumatic. So I also share Carol's concern that there is not a connection between when for families. I don't know, Lori, if you see that.
Yes, we do. It is so difficult with people, especially with the co-occurring where you brain injury as well as mental health difficult individuals find that new place able to relate to their getting all the care that they really need to help them claim their way.
We have another question that's come in from Judy Seiler. I'm sorry if I'm not getting your name right, but it says because of COVID and budget issues, paras have been cut back on. I can't imagine the school having less paraprofessionals. We will need more after this, not less. Also, budget issues had places like the retreat get rid of art therapy and things that can really help folks during hospitalizations versus just trying meds. And I know students that are home now, the paras are not reaching out to. And we actually heard we had a panel early on in this on education during COVID, and we had a paraprofessional on, and really she was feeling like she was not allowed to do her job because she wasn't allowed to reach out to parents and teachers. And it wasn't so much as I would rephrase that out of not allowed to do her job, but that are not empowered to make those connections with parents and students. And I agree that we're going to need more of that kind of support and not less of it going forward. And I don't know if any folks and also I would agree about art therapy and other types of therapy that aren't medication. Don't want to try it, or that's not the right option. And so, uh, if anyone else would like to speak to that question, that would be.
Know that in early conversation, advice because I work in a school and navigated this on the fly. Early recommendations by the agency actually that the paraprofessionals not reach out because they weren't sure about the technology and they weren't sure about liability. Like it was so many moving that was actually the recommendation. Although then they tried to kind of work it back in. And I think one of the real struggles that I've certainly with some of the kids that I work with, that once that relationship is severed, it's hard to get it back setting. And so, we had paras who kids one-on-one who were of time don't, you can't reach out. And then the kids, you're right, Judy, you feel completely abandoned. And why would they reconnect? Because when are you going to abandon me again? This horrible thing happened and you're gone. And so it created this really horrible situation. And I've been supporting some I work with to try and navigate that as well to really, how do we build connections back, because those kids do feel completely.
To me, this goes back to the ability that we have to say out loud right now that whatever you're doing is uh, the individual. To kids, to parents, to teachers, with the capacity that you have are enough. And I think that it's something we don't say enough in general, but we have to right now, because not all kids have been able to get online and stay online to work that way. Not all parents have been able to monitor their kids all day because they also have to work from home or they're going out to work. Not all uh, people who are working from home, this is something that's working for them. A lot of folks are struggling. Not all folks called back to work feel safe being called back to work, and it's been hard for me to see that fear building for a lot of people, because that insecurity about that they are not enough. And I really want to take a moment in this panel to say that wherever you are and whatever it is doing right now and capable of, you are enough. And this is why we have to talk. So as we're getting ready to close, one thing that I'd love is everybody to, each panelist to say one thing that I always say an action item, but in addition to an action item, one or two of like key resources out there they need. So one or two or three key resources and an action item in terms of supporting mental health improvement and funding and whatever you think. And we will start with I'm going to do Michelle. I'm going to do you second to last. So we will start with Anya.
I'm going to need you to repeat your question because I was preparing.
Okay. I said that I one, two, or three resources that are out there, and also an action item, an action to improve for improving or funding.
Thanks, Brenda. So resources that I know are out there, I've mentioned them before. We have the Vermont Support Line, which 365 days. Anyone can call for any reason just to be provided support. Alyssum, which is and does provide respite support for people who are struggling. My only struggle is that they have chickens. I don't have an affinity for chickens. But it's a beautiful nature filled space where you process whatever's and then an action item I think is to come together as a community and build activism, political energy. I think that when the together and fight for, then we can have all of the things that we have talked about. And so the action item that we unite together and we demand that people have what they are elected.
Thanks, Tanya. I take copious notes on these things when people are saying them, so that's what I'm doing. I would love now to hear from Christine.
All right, couple resources. So I mentioned before, there's the HCRS crisis line. I don't know if you have the number or if I could give the number 1-800-242-5, and that's for all Wyndham. And also the additional warm line open to HCRS clients and the community as well. And that's 800-917-1622. And then the other resource is HCRS has access navigators. Give them a call. There's one in Hartford, Springfield, or Brattleboro, and they can help connect you to whatever it is. And right now we are have same day access. I can give those numbers. I'll send them to you and post them. Does that work? I guess I would just follow up with what Michelle talked about, kind of statewide. I know at HRS have really worked hard with crisis to be mobile and to meet people where they're at and to see that spread. Because I think that's really, no pun intended, moving in the right direction.
Thank you. What we found is that these action items and these resources are incredible tools of of the program, and so that they can really walk away. Lori.
Some resources that you can look for is on the NAMI Vermont website at nami.org. And on our website, every single week we have different things going on with Zoom or by telephone with a wellness check on Monday at noon. We're doing inner own voice presentations with people who have lived experience, living our stories. And we also have support groups every single week throughout the state, but because in that, we also have a resource guidebook. It's a 100-page guidebook. It gives you a ton of resources. If people like to text and would like to text a crisis text line, text VT 741-741. And I think really the call to action would be every year, NAMI Vermont, along with Vermont Care Partners and MHAR, help to organize mental advocacy state house. And we really, we've been doing this for about 5 years now. We're really trying to raise the awareness about mental health. And we need to keep talking about it with our legislators, as well as have a lot of people from the community with that lived experience, because sharing those stories has the impact on legislation and can do very powerful things just by their lived experience. I invite all of you to come to Advocacy Day in January, last Wednesday of.
Thank you. And I wanted to just ask you, can you tell me that text line again?
Sure. So you text the acronym, well, VT for Vermont, and then 741-741 text. And it's a nationwide crisis line, and Department of Mental Health has working with them to find out how many do text them. And they do provide great support. And if somebody is at risk of suicide, they are able to get the help. So it's not 100% anonymous crisis.
Michelle.
I was going to recommend, have already been, I'm involved with NAMI, and I would always recommend, that's a good. I'd also say just a concrete way, happen to be lucky enough to live in the county. I actually have phone number, and the crisis actually an 8 my phone. And as a support group, I have occasionally call me and say, "Gosh, I'm having this very difficult." Call the crisis team, and the crisis team is so helpful, much more direct than just dialing 911. And eventually, but if you have life who sometimes has these kind of struggles, getting the right people there to support. And so I also would encourage you as an action step, advocate with the legislature. One of the reasons I decided to run for office is I realized I was constantly contacting my legislators, talking about a variety of things. Mental health was probably the I contacted them about more than. There came a point where I thought, why am I always telling them what to do? Why don't I? Oh. And then there also came a point where a couple of them started asking me to testify on behalf of certain. I thought, well, my voice. And so I would really encourage as an action step that everybody get involved with this because it's a but it's our political system that could either be better or make it. And so I would like to see our legislative part of build a better and a safer. And if we can all unite around that, that can happen. And personally, my commitment, I'm going to keep talking about. It. And I hope we can.
I think that the resources that I tend to reach out to are all and take and accept that I want to just advocate for a couple of resources which that are not in our area, Windham County and Windsor County, but the Howard Center in Chittenden County and reaching out to community justice centers if there's a conflict instead of a police, if possible, and if that can help with mental health issues. And if you are suffering from substance use disorder, please do find your harm reduction center, which is a place free of judgment and where you can help yourself to be able to stay alive uh, where you are at right now. And so the Howard Center does have safe recovery, and that is a place that you can do that as well. And then I think that there are some I think all these other resources have been incredible. I'm taking notes at the same time. Uh, and then, as an action step, I want to reiterate that ask to testify. And if you're not granted the ability to testify, then send in written testimony. And and also when folks reach out to you about an issue that will affect people's mental health, please also be willing to rate written testimony or ask to testify. If you're someone who understands that issue. I know that Tanya has, and on an issue bill right now in the legislature that it will cause harm to substance use disorder. And NAMI Vermont has actually signed on to that letter, I think, as well. And so we're really talking about the need for us to all work towards changing the stigma and outcomes. And so that means please be able, say, willing, say yes when somebody asks for help if it's something that and take the time to listen. And like I said with Tanya, like Tanya said, to believe when they say what they. So I want to thank everyone for attending tonight and all of the panelists for coming on. If you are someone who is in need of any supports and you want to reach out to us, you can certainly reach out to me at brenda@brendaforvermont.com. We have a statewide mutual aid effort in Essex County. Tanya has been working on a mutual aid effort there, and we help connect you to mental health resources, other resources.
Brenda, I'm not in Essex County. I'm in Essex, Vermont.
Sorry. Essex, Vermont, not Essex County. There are two different things, but I did know that. And uh, and uh, and so we can get you some of that support. You can find it right on our website, and also you can find the resource list on our. It does go to Tanya's and we will add some of these resources to that list as well, so that you can find does anyone have anything last minute thing to add? No.
I'll add like just a 30 seconds. We don't really have time to explain, but one of the ideas that I think the rest of this benefit from is mental health course. I believe in County, they use that to a certain, I believe, Cheshire County across the river in New Hampshire. There's on a certain level in our system a criminalization of mental illness. Have a mental health condition, more likely to be violating laws, and the underlying cause of what is causing you to break that law, they send you to in prison, not solve your mental health. And so I think that as a system, as a state, we could actually look at what are the underlying causes that are causing these. That would really be helping to heal our individuals in our community and to heal. So that's a very big conversation. We could probably do a whole session about that, but I didn't want to close this session without at least.
Well, I think we will do a criminal justice reform question panel sometime that hopefully I'll have a lot of folks back on and some more because I do think that mental health intersects with the criminal justice system quite a lot, and it's certainly my nephew and a lot of harm. And so I want to thank everyone for being here and all folks for attending. Please do check out Tanya Vyhovsky. Did I get it? Yes. Tanya Vyhovsky, Michelle Boslin, and getting it. And my website. And please check out NAMI Vermont and HCRS as well. And if you're able and comfortable, please make a contribution to our joint contribution link and contribution to help us go to Montpelier and fight for these. Thank you all for attending. Thank you, Lori, Christine, Michelle, and Tanya. And I look forward to having more of these incredible conversations with you about this campaign. And thanks so much. Good night,
Thank
everyone.
you.